To determine whether you have heart failure, your healthcare providers will first ask about your medical history, your family's history, your symptoms, and your health in general. They'll also do a physical exam, and then based on your situation, they'll recommend various tests. Lab tests help your healthcare providers assess hormones involved in heart failure, your kidney function, and the level of chemicals like sodium and potassium called electrolytes in your blood. Next, your healthcare providers might order one or more tests to get images of your heart and/or your lungs and check how well they're working. These might include a chest X-ray, EKG, Echocardiogram, Nuclear cardiac exam, MRI, or CT scan. To learn more about these tests, view this special topic on heart tests using the DVD menu. To check your heart's pumping ability, your healthcare provider will use an echocardiogram or other imaging test to measure your ejection fraction. Your ejection fraction, or EF, is the percentage of blood your heart pumps out with each heartbeat. In a normal heart, the left ventricle pumps out 55 to 75% of its blood with each beat. In heart failure, the percentage of blood pumped out can be quite a bit lower. Monitoring your EF can show your healthcare providers how well your heart is responding to treatment. With the right treatment, some patients see their EF improve, even all the way up to a normal range. And patients with heart failure caused by a stiff heart muscle often have a normal EF.
How often will I have blood tests?
Heart failure patients, when they're initially diagnosed, may need blood tests fairly frequently so that we can adjust your medications and see how you're responding to treatment. But over time, as your condition stabilizes, we will do blood tests less frequently.
If you check my ejection fraction today, when will you check it again?
We usually wait a few months to check your ejection fraction after we reach the maximum doses of your heart medication. This allows your body to adjust to the medication, and it allows us to then assess the response to the medication. What we want to do is use the medication doses that were used in the clinical trials to give you the maximum chance of having improvement in your heart function.
Your healthcare provider may start treatment by prescribing various medications, adjusting the doses over time, and adding other meds as they're necessary. Medications help your heart in several important ways. As the heart begins to struggle, the body releases hormones to help the heart beat stronger and harder. For a while, these changes help your heart meet your body's needs, but over time, they put an extra strain on your heart that wears out the heart muscle even more. Some of the meds commonly prescribed for heart failure block these stress hormones and give the heart a chance to rest and recover. ACE inhibitors, or a similar medication class called ARBs, block stress hormones. They also help to decrease the pressure in blood vessels, so it's easier for the heart to push the blood forward. Beta blockers block stress hormones, and they also slow down the heart to ease its workload. Aldosterone receptor antagonists block stress hormones. They also help to rid the body of excess fluid and help you retain potassium, a necessary mineral. Diuretics, such as furosemide, also help rid your body of extra fluid. Getting rid of extra fluid is a very important part of easing your heart failure symptoms. Digoxin helps irregular heart rhythms and helps improve your exercise tolerance a bit. Anticoagulants, such as warfarin, are used in some patients to help prevent blood clots from forming or from getting larger. Mineral supplements replace the potassium and magnesium in the body that may be lost more quickly if you take a diuretic. Generally, we also recommend taking a good multivitamin.
Medications can make a big difference in how you feel and whether you live well with heart failure. And it's important to make sure you know why you're taking medications and how to take them. Be sure to ask questions when you get any new prescription, like when and how to take it and what to watch for.
When you're taking 3 or 4 medications, it can get a little confusing, so I like using a pill box for each week. That helps me keep things organized.
Depending on your condition, you might also have medical procedures to correct the cause of your heart failure or deal with its effects. You might have a procedure to open up or bypass blocked coronary arteries, or surgery to repair heart structure problems. Many heart failure patients have heart rhythm problems, and these might require other medications or procedures to treat the problem. You might have a pacemaker or internal cardiac defibrillator placed to help control your heart rhythm and to shock the heart out of a bad rhythm. Or if your ejection fraction stays low enough, though you're taking medications. In other cases, you might need a procedure called catheter ablation. This procedure targets cells that are causing abnormal electrical activity in the heart. And if you go into end-stage heart failure, which means your usual treatment no longer helps, and you still have significant symptoms, you might need a heart assist device like an LVAD or heart transplant. But the most important part of heart failure treatment is up to you. No matter how your heart failure started or how severe it is, there's a lot you can do to manage it. By making some changes in your daily habits, taking your prescribed medications, and keeping in regular touch with your healthcare team, you can make sure your treatment is the best it can be. Even simple actions can make a major difference in your health and produce dramatic results in how you feel.
I kind of resisted the treatment plan at first. It seemed like too much trouble. But then I decided to try the diet advice, cutting the salt, not drinking so much water, and I couldn't believe it. In a week, I started feeling a lot better. That showed me that it really matters.